Hi everyone, thank you for joining the KT Task Force today with another educational video for the PT Management of Parkinson's Disease CPG. This video is going to show you several examples of a person with Parkinson's disease performing several variations of strengthening exercises. Our focus will be on options for variations and form. We will discuss dosage some, but there is a written summary of dosage recommendations on the KT Task Force website. Our volunteer in this video is Becky. She was diagnosed with Parkinson's nearly 10 years ago. You'll see throughout the video that some of these exercises are easier or harder for Becky, and therefore not all an appropriate choice for her. However, we wanted to demonstrate several options. In addition, Becky participated in 2 hours worth of exercise to help us film this video, and we wanted to make sure that she wasn't overly sore or fatigued during or after the session. You'll also see several folks in the background. Please rest assured they knew they were being filmed and had no concerns. We get started here with multiple variations of a chest press. This strengthens the pecs, shoulders, and triceps. You see Becky doing all of these in a supported position, which is great for someone with balance concerns. You could also do variations of this in standing or sitting on a TheraBall for some balance and core component. Next we have lat pull-downs, shoulder presses, and reverse flies. These are great exercises to use for postural strengthening of the lats, rhomboids, and traps. It can also be adapted to include a little bit of balance and core strengthening challenge by performing in standing or adding some instability with a TheraBand or foam discs as the patient is able. Biceps and triceps strengthening may be less common during a PT session, but when building a strengthening program as part of an overall exercise plan, most major muscle groups for upper and lower extremities should be addressed with an increased focus on the extensor muscles. Training should be performed during the on cycle of medication. What we learned from the CPG is that strengthening should be part of a multimodal program and occur 2 non-consecutive days per week for a 30 to 60 minute session. Intensity should progress to 80% of a repetition maximum. However, beginners should start out at 40 to 60% with higher repetitions, and those already experienced with strengthening can start at 80% of their rep max with lower repetitions. There are several ways to estimate 1 rep max for those that are not safe or capable of performing that testing. All of this info can be found on the ANPT CPG KT Toolbox summary sheet on the ANPT website that I referenced on the opening slide. Now we move on to some lower extremity options. We start with heel raises because we know that the calf muscles greatly contribute to gait speed, which is often impaired for people with Parkinson's, so this is an important one to include. Like the upper extremity exercises, these can be adapted to include some instability and therefore challenge balance and core strength. However, make sure if you are adding a modification to get more out of the exercise, that you don't take away from the original strengthening intent of the exercise. Here we show some squat and lunge variations for hip strengthening, and you can see at the start here that the lunges are not a good fit for Becky because she's having trouble figuring out and completing this exercise. She also has a history of OA and knee pain, and these were painful for her. This will be common, and the need for adaptation will come up regularly. This is why we are showing you so many different modifications of the same exercise. Adverse events could involve falls, and those with balance deficits may need to be supervised depending on the exercise. A rehabilitation or exercise professional should assist at the beginning with developing a strengthening routine. Those experienced may benefit too to ensure optimal biomechanical form and take into consideration the specifics of Parkinson's disease. When it's possible, don't hesitate to use an exercise professional such as a personal trainer or exercise physiologist to help ensure people are safe and using appropriate form. The leg press and knee extension machines are also good options when squats are not feasible. Here Becky is in a seated leg press, which is going to require a little bit more adjusting to bias her glutes by increasing her hip flexion some. Supine leg presses may be easier to bias glutes, however, they can be difficult for patients to get on and off. Thank you again for joining us. We hope this video was helpful and be on the lookout for more resources. Thank you.